welcome back to my channel. I have another PICMONIC video for you guys, and I'm going to show you how I use PICMONIC as a new grad nurse. Now, I know you're thinking, why would a new grad nurse be using PICMONIC? You already studied for NCLEX and passed. Yes, I did. But sometimes I need to go back into my material and be like, what is this? I had a patient with this. How do I treat it? What signs and symptoms do I look for? I am an L&D nurse, but we do have med-surg patients which also happen to be pregnant and having a baby. So often I do return back to my PICMONIC account just to give me a little bit of refresher of like, why did I have to give them this medication? Was the patient presenting with symptoms? So let me give you a little bit of an overview about PICMONIC and what it does. PICMONIC is an auditory visual study tool for students in medicine, pharmacology or pharmacy, nursing, physical assistant, physical therapy, occupational therapy, paramedics, and many other healthcare professions. It is a research-proven method incorporates the best study techniques by transforming need-to-know facts into memorable stories and characters. PICMONIC has comprehensive learning quizzes, review study app applications, which provides extensive coverage of topics, facts, and concepts that students need to learn in order to have success in school and easily pass their boards or certification exams. Now that's just a little recap of what PICMONIC can do for nursing students. No, it's not just for nursing students. I want to reiterate that. PICMONIC is not just for nursing students. As a new grad nurse, sometimes it can be very overwhelming in getting a patient who has a high acuity. For me, I have laboring mothers who have preeclampsia, who have chronic hypertension, who have diabetes type 1 or type 2, or who have other comorbidities that are not related to pregnancy. So I still use this tool, especially pharmacology. I am always referring back to pharmacology because often I give meds that aren't labor related. So I'm going to go ahead and show you a little bit about what PICMONIC offers and how I kind of go back and review medications that I may need to refer to because I just don't give them enough. So I went to my browse little button here, and then I go down to Pharmacology of Nursing. As you can see, there's tons of other subjects that you can review. Here's obstetrics, you have peds. I know peds are favorite for some. You even have cardiac. The next system I will be going over is cardiac, but today we're going to go ahead and do pharmacology. So as you can see, it has 9 hours and 3 minutes of a wonderful tool that you can use for pharmacology. So we're going to go ahead and click Learn. Alright, so here you can see that there's tons and tons of topics to be covered. You have your Pharmacology Basics, you have nervous system, cardiac drugs, hematology drugs, musculoskeletal drugs, renal system, endocrine, the whole shebang, So what we're going to do is, I know cardiac can be very difficult for some, and I'm going to go ahead and we're going to just click on cardiac and see what there is. So as you can see, you have your basic meds, your antihypertensive, antiarrhythmics, your endotropes, and your dyslipidemia medications. We're going to go ahead and do hypertensive because I know that a lot of Americans suffer with high blood pressure, and those are one of the most common meds that I am giving even as a labor nurse. So we're going to go ahead and go to Explore. This topic of antihypertensive has 11 PICMONICs and 20 minutes worth of great study stuff. So we're going to go to Explore, and here you can go ahead and see what PICMONIC has. So you have hypertension medications, you have your beta blockers, you have your angiotensin converting enzymes. Who remembers those? ACE inhibitors. You have your ARBs, you have your mini press, and then you have the rest. I mean, there's just so many medications. Nitro, that's a big one. Saw that on NCLEX. And just diuretics. You know, what is our teaching for potassium-sparing diuretics or not potassium-sparing diuretics? All those things. So let's go ahead and go to potassium-sparing diuretics. And we're going to click on that. And as you can see, you can go ahead and you can play the PICMONIC or you can start the quiz. I like to play my PICMONIC, listen to the story that it's telling, and take notes as I do. So as you can see, it's It's so cute. You have 2 bananas. And what's in bananas? Potassium. So you listen to the story, and you just, what I like to do is I like to listen to the story first. Then I go back, replay it, and take notes as needed. So let's go ahead and listen a bit.
Potassium-sparing diuretics may be indicated for patients with hypokalemia. The hippo banana, as these drugs help retain plasma potassium. The potassium-sparing diuretic spironolactone can also be used to treat hyperaldosteronism, the hiker aldostereo. There are 3 main drugs in this class: spironolactone, amiloride, and triamterene. These medications work in the collecting tubule, illustrated as the collecting tube, the section of the nephron acted upon by aldosterone. Spironolactone, the spiral of milk, is a competitive aldosterone receptor antagonist, portrayed as the...
So as you can see, it tells this cute little story, and they have these fun images and characters that really aid in memory retention. And you can go through the little, I guess this is kind of like a context, and click on something maybe you need to review. It's like, hey, you know what, I need to kind of review the collecting tubule. Let me go back to that section. And you can, and then you can play it as many times as you want. It's very, very useful. So here we're going to go to side effects. So let's go ahead and click on that. And we're just going to play the side effects section.
Inhibit the excretion of potassium. It can accumulate in the bloodstream and cause hyperkalemia. The hiker banana. Spironolactone can cause the side effect of gynecomastia, the man boobs, because of its anti-androgenic properties. So, remember, potassium-sparing diuretics treat CHF and hypertension, and are...
So as you can see, they make it super fun. They referred man boobs as a side effect of taking potassium-sparing diuretics. So, I mean, how can you not love that? It's so funny. I mean, man boobs, come on. And it's true. It really is true. So then you can add facts if you want. So I am just going to add meds. And then you can go and you can, add more meds or whatever to your story, and you can create your own custom story, which I really, really love. Or you can ask questions as well, classifications, upload images, and just build your database of knowledge right within the app. I really love this app. I do have a coupon code for you guys if you're interested. It's 20% off. It'll be in the description box below. I'm going to be covering cardiac section next time I do a video. Make sure you subscribe and stay a while and join the family. And I wish you much, 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 much success in your nursing program if that's where you're headed. If I can do it, you can do it. Trust me. Mom of 3, wife, student, new nurse. If you can do it, I can do it. I believe in you. I hope you guys enjoyed and have a good one. Bye.